Yes, sir.
We are live, sir. We can start now.
A warm welcome to all of you. ExRxIndia presenting for the students by the students webinar series. First of all, I would like to thank ExRx founder Dr. Chandramohan and Shamraj Health Service Private Limited CEO Mr. Sampath Kumar for their continuous support. Secondly, I would like to thank Dr. Rupesh and Professor Duna Saha for their tireless hard work and continuous support. I thank all the future physiotherapy graduates for supporting and contributing to our For the Students by the Students webinar series. This program is not a competition, but this is to bring you out and build your confidence for public speaking. This is Bhairav Sudarshan from Chennai. Today, the first topic will be presented by Shifana Parveen from Krishna College of Physiotherapy, Krishna College of Paramedical Sciences and Paramedical and Allied Health Sciences, Samayapuram, Trichy. Today's topic will be on renal circulation.
Shifana,
Please share your screen.
Okay.
Switch to landscape mode. Rotate it.
Okay.
You can start now.
Visible, ma'am?
Yes. Clear. Would you like to switch your video on?
Yes, ma'am.
Now just go to presentation screen.
Can I start, ma'am?
Yes, please start.
Okay. A warm good evening to one and all. I'm Shifana Parveen, PPT first year student from Krishna College of Paramedical and Allied Health Science. First of all, I would like to thank Dr. Chandramohan sir, Dr. Rupesh sir and Duna madam for giving this wonderful opportunity. Thank you so much. Today we are going to learn about physiology of renal circulation. One has to know about renal circulation very well, because if you know about the renal circulation, from where the blood is coming and from where the blood is going, then only you understand how blood purification occurs. So it is very important to learn about renal circulation. This is outline of my presentation: introduction, renal blood vessels, measurement of renal blood flow, regulation of renal blood flow, special features of renal circulation. Let's move into the introduction. The renal circulation supplies blood to the kidney through renal artery, which is the branch from abdominal aorta. In the adults, during resting conditions, both the kidney receives 1300 ml of blood per minute, which is about 26% of the cardiac output. First of all, if you learn about renal blood vessels, these are the renal blood vessels. The renal artery, which entered the kidney through hilum, while it passing through renal sinus, it divides into segmental artery, which is further divided into interlobar artery, arcuate artery, interlobular artery, afferent arteriole. Then the afferent arteriole enter into the glomerulus of nephron. Then it forms glomerular capillaries and leave the glomerulus as efferent arterioles. The efferent arterioles continue as peritubular capillary, vasa recta, and it drains into venous systems such as interlobular vein, arcuate vein, interlobar vein, renal vein, then finally drains into the inferior vena cava of the heart. Let's see detail about arterial system. Renal artery, it arises from aorta and enters the kidney through the hilum. While passing through the renal sinus, the renal artery divides into many segmental arteries. Then the segmental arteries further divided into interlobar artery, which passes in between the medullary pyramids. At the base of the pyramid, it turns and runs parallel to the base of pyramid, forming arcuate artery. Then the arcuate artery is further divided into interlobular or cortical radiate artery. It runs through the renal cortex perpendicular to the arcuate artery. From each interlobar artery, numerous afferent arterioles arise, which enters the Bowman capsule and divides into 4 or 5 large capillaries, which are called glomerular capillaries. Each large capillary divides into small capillaries which form the loops. The capillary loop unite to form the efferent arterioles, which leave the Bowman capsule. The efferent arterioles form a second capillary network called peritubular capillaries, which surrounds the tubular portion of the nephron. Peritubular capillaries. These capillaries surround only the tubular portion of the cortical nephrons, which forming a meshwork of micro vessels, which function is to remove water and solutes. Vasa recta. This capillary surrounds only the tubular portion of juxtamedullary nephron. Then these drain into the venous system such as peritubular vein, interlobular vein, arcuate vein, interlobar vein, segmental vein, and renal vein, which leave the kidney and joins inferior vena cava of the heart. This is a flow chart of renal blood vessels. How to measure renal blood flow? Renal blood flow can be measured by the following methods. First is with the help of electromagnetic flow meter, the renal blood flow is measured. The second one is para-immunoepuric clearance method. This method is also used to measure renal plasma flow. Renal blood flow is also measured by using the below equation. Renal blood flow is equal to renal plasma flow divided by 1 minus hematocrit or packed cell volume. Regulation of renal blood flow. The renal mechanism affect the renal blood flow and glomerular filtration rate by changing the arteriolar resistance. Regulatory mechanism of renal blood flow includes autoregulation, hormonal regulation, and nervous regulation. First, we are moving to autoregulation. As you all know, there are three vital organs in our body, namely heart, brain, kidney, which show autoregulation of blood for them. What is autoregulation? It is the intrinsic ability of an organ to regulate its own blood flow. The autoregulation of kidney is also important to maintain glomerular filtration rate. Blood flow to kidney remains normal even when the mean arterial pressure vary between 80 mmHg and 180 mmHg because of the autoregulation. Two mechanisms are responsible for autoregulation of renal blood flow and glomerular filtration rate, namely myogenic response, tubular glomerular feedback mechanism. First one is myogenic response. When the mean arterial pressure increases, it leads to increase in renal blood flow. When the blood flow to kidney increases, it stretches the afferent arteriole. This was sensed by myogenic stretch receptors. Then it caused increase in opening of voltage-gated calcium channels. When the voltage-gated calcium channels open, there will be more influx of calcium ions from extracellular fluid to vascular smooth muscle cells. Then it causes contraction of vascular smooth muscle cells. It leads to vasoconstriction of afferent arterioles. Then the renal blood flow decreases to normal level. This is the table of myogenic response. When the blood pressure increases, the myogenic response causes vasoconstriction of afferent arterioles. Then the renal blood flow decreases. When the blood pressure decreases to normal level, the myogenic response causes vasodilation of afferent arterioles. Then the renal blood flow increases to normal level. The second mechanism is tubuloglomerular feedback mechanism. When the arterial pressure increases, it leads to decrease in, the second one is tubuloglomerular feedback mechanism. When the arterial pressure decreases, it leads to decrease in renal blood flow, glomerular filtration pressure, and as well as glomerular filtration rate. Decrease in glomerular filtration rate slows the flow of filtrate in whole tubule of nephron. It causes increase in reabsorption of sodium ion and chloride ion in the proximal convoluted tubule. It causes decrease in sodium and chloride concentration. The macular densa cells, which you locate at the top of ascending loop of Henle, which detect the low concentration of sodium and chloride ions. Then the macular densa cell release vasodilator substance to increase the afferent arteriolar resistance. Then the vasodilation of afferent arteriole occurs. It leads to increase in renal blood flow. This is the table of tubuloglomerular feedback mechanism. Whenever the blood pressure increases to normal level, the macular densa cell release vasoconstrictor substance such as adenosine, thrombosin. Then it causes vasoconstriction of afferent arterioles. Then the renal blood flow decrease to normal level. Here are the two mechanisms when the blood pressure decrease to normal level. The first one is when the blood pressure decrease to normal level, decrease below to normal level, then the macula densa cell release vasodilator substance such as nitrous oxide, prostaglandin, and cause vasodilation of afferent arterioles. Then the renal blood flow increase to the normal level. The second mechanism is whenever the blood pressure decreases below normal level, then the macula densa cell sends signal to juxtaglomerular cell, which increase the secretion of renin. The renin helps in the formation of angiotensin 1, which is further converted to angiotensin 2. The angiotensin 2 cause vasoconstriction of efferent arterioles. It causes increase in high glomerular capillary hydrostatic pressure. Then the renal blood flow increase to the normal level. As I mentioned before, whenever the arterial pressure decrease to 80 mmHg, the autoregulation is virtually absent. At that time, the hormonal regulation will act. These are the hormones which cause vasoconstriction and decrease the renal blood flow. There are norepinephrine, angiotensin 2, endothelin. There are the hormones which cause vasodilation and increase the renal blood flow. There are prostaglandins, nitric acid, bradykinin, dopamine, and histamine. Nervous regulation. The afferent and efferent arterioles are also innervated by sympathetic nerve fibers from T10 to L2 intermediolateral gray segments of spinal cord through the splanchnic nerves. Under normal circulatory conditions, sympathetic tone is minimum. Moderate to mild stimulation of sympathetic nerves has mild effects on renal blood flow because of autoregulation mechanism. But in strong acute stimulation of sympathetic nerves may produce marked fall in renal blood flow due to constriction of both afferent and efferent arterioles temporarily. This effect is mediated mainly by alpha-1 adrenergic receptors and also by postsynaptic alpha-2 adrenergic receptors. Let's move to the special features of renal circulation. Renal circulation has some peculiar features. The first one is this is the only circulation where capillaries drain into arterioles. Elsewhere in other circulation, the capillaries drain into venous system or venules, but in the kidney, the glomerular capillaries drain into efferent arterioles. The second one is both the kidney receives very high blood flow, about 1300 ml of blood per unit time. The kidney is the second organ which receives very high blood flow, about 1300 ml of blood per unit time. The third one is renal circulation has a portal system. That is, it has two sets of capillaries. One is the glomerular capillaries and another one is the tubular capillaries. Fourth one is it has very high capillary hydrostatic pressure, which is about 60 to 75 mmHg. Elsewhere in other organs or other circulation, the capillary pressure is about 15 to 25 mmHg. But in the kidney, it is about 60 to 75 mmHg. What is the reason for this high capillary hydrostatic pressure? Because the afferent arteriole is wider than the efferent arteriole. All of the blood comes into the glomerulus, will not leave the glomerulus through efferent arteriole. There are some extra accumulation of blood in the glomerulus, which cause high capillary hydrostatic pressure. The fifth one is in the kidney, blood flow regulates metabolic rate, oxygen consumption, and ATP production. Elsewhere in other organs, the metabolic rate regulates blood flow, but in the kidney, blood flow regulates metabolic rate. Sixth one is it has high capillary filtration coefficient in glomerular capillaries. That is about 12.5 ml per minute per mmHg. Thank you.
Very good presentation. Actually, we are going to have a rehabilitation after renal transplantation. Okay, so this gives a short idea about renal circulation, and it will be helpful for ourselves. And I thank Dr. Srinivasan, Principal, Krishna College of Paramedical and Allied Health Sciences, and Dr. N. Bobby, Vice Principal, Krishna College of Paramedical and Allied Health Sciences, and all your professors who supported you, and all, of course, your friends who supported you. And I thank you for taking part, contributing for the students by the students web series. And you are getting a lot of appreciations, even from senior most physiotherapists. I can read from Jitendra. He is working in Delhi Government Hospital, GH. And would you like to take any questions? Actually, we are not entertaining any questions. Okay.